advisory group. I've got a meeting of that on Friday. We've done this big Q&A to try and sort of answer everyone's questions. Yeah.
Okay.
So, yeah. So I think that's basically just summarising 30,000 GWAS studies, saliva samples to identify genetic markers, and then expansion of the biobank. Right, I think that's probably all I'm going to say on research. As I say, I'm not going to give you a lecture on management of ME/CFS, but I will just run through a few important points that's going on in management at the moment. First of all, as I've already mentioned, we are rewriting this wretched nice guideline. Unfortunately, one thing that cannot be done at the moment, and the ME Association tried to do this, we had a petition about it. Of course, there is this recommendation in the current guideline that everyone should have a course of CBT and graded exercise, and we have tried unsuccessfully to get this guidance removed or a health warning issued from NICE. But of course, until NICE has reviewed all the evidence, which is what we're doing at the moment, the official body is not going to overturn its current guidance. So that guidance stays at the moment until, I think possibly until October 2020 when the new guidance comes out. You may have seen, it's on our website, that the Forward ME group of charities, there have been numerous studies, patient studies, patient questionnaire studies, and there's some results from our own big one there. It's called No Decisions About Me Without Me. We've taken feedback from the patient community on what happens to people with CBT and graded exercise, and we did a big study at the beginning of the year which has been submitted to NICE. I can't remember how many respondents we got, it was several thousand. And yet again, it demonstrated that probably, well certainly over half of people who have graded exercise therapy get worse as a result of it, and most people who have CBT gain no benefit from it. Having said that, clearly these are not treatments for ME/CFS, but having said that, there is no doubt that there are a certain number of people who have got emotional and mental health issues associated with ME/CFS, as can occur with any long-term medical condition, who do find CBT helpful, providing it's given by a therapist who fully understands ME and is not trying to treat ME with CBT, but is trying to help your depression or your stress or everything else, or just not being able to cope with this wretched illness. The other thing that's going on at the moment in relation to NICE is that we have set up 2 focus groups, so people are being invited who have got children or adolescents with ME, or adolescents themselves can come along, and people with severe ME or their carers can come along. So that these are actual meetings where people can come along and talk about all the issues that are related to children, adolescents and people with severe ME, and I think those focus groups will be taking place very shortly. So these are the survey results from the big Forward ME group survey, and as I mentioned, one of the interesting findings was where people had mental health problems, emotional problems, just not being able to cope with it, this illness. There was quite a significant degree of improvement in the people who had CBT. So it did help there, but it was not helping with the disease process. And I can't see any point in giving people CBT to try and improve their ME. At the same point, the graded exercise results, even the mental health deteriorated in 53% of people having graded exercise. Their physical health, 67% actually deteriorated. And I mean, quite frankly, if graded exercise was a drug, it would be banned. You couldn't be prescribing a drug to people that was causing such a degree of harm that was being shown in survey after survey after survey. Yeah.
In the medical community, is that a suggestion for any other illness? Is it just ME?
Sorry, you have to just Could you clarify that?
Sorry, so GET and CBT,
Yes.
is it recommended for any other illness?
Oh, I see what you mean. Well, CBT, I mean...
Well, I understand for
Yeah.
CBT for mental health issues,
Yes,
but for an actual...
yes. I'm not aware of any other illness, apart from obviously for certain mental health conditions, where CBT is recommended as a form of treatment. There's no physical illness that I'm aware of, and I'm sure there isn't, where CBT is recommended as a form of treatment. I mean, it is of course used sometimes quite successfully in people with cancer and MS and whatever, who again have got emotional, mental health issues, who are not coping with the illness. But to send someone off who's got MS to have CBT, who's not depressed and is coping with their MS and whatever, would be regarded as, as ridiculous. And that is the point we're making to NICE, and I think actually NICE has got the message.
But do NICE understand that the DWP funded the PACE trial?
Yes.
Right.
Yes. Yes. I mean, we won't go into the PACE trial, but of course, as you know, the DWP, and I worked with the DWP for many, many years. The DWP thought that by funding the PACE trial would demonstrate that CBT and graded exercise would work.
Well,
Of course, that this would get loads of people off benefit and back to work.
well, of course, but we are because
Yeah. But I mean, one of the things, without getting stuck in the PACE trial, I mean, one of the things which we do know, without having to go to freedom of information and take them to court about it, was the fact that the people on benefit actually slightly increased during the PACE trial.
yeah, I think my point was that we are the only group with a physical illness that is offered.
The simple answer is I think we are unique in that respect, which is very, 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 very sad.
Can I ask a question? Sorry, Dr. Are you getting any reports that patients such as ourselves who are on opiates or pregabalin or their derivatives are being pressurized to give them up or reduce them because now opiates and pregabalin
Well,
seems
yes,
to be a dirty word?
yes. Yeah. Well, that is the case, especially with gabapentin and pregabalin. We as doctors have been issued with new guidance. In fact, I've redone our pain leaflets on gabapentin and pregabalin to include this advice. So advice came out, it's fairly recent, only a few months ago, that we've got to be much more careful across the board in prescribing these type of pain-relieving drugs. So you may well have come under some pressure than whether you have, but possibly. Yeah.
Sorry, the question was really based upon the fact that obviously a lot of people have problems with opiates and with pregabalins.
Yes,
Specifically,
especially the pregabalin and gabapentin
Yeah.
are anti-epileptic drugs which have been shown to be helpful
because
in
of
pain
inappropriate
management.
prescribing. Now everyone seems to be coming under this pressure whether
Yes.
or not their
Yes.
prescribing
Yes.
is appropriate
Yes.
or not.
Yes. And I mean, the other side to that, which is rather sad, is that we have what some doctors would call a pain-relieving ladder, you see, for the use of drugs. And in the case of ME/CFS, most sort of ordinary analgesics like aspirin and paracetamol and brufen and whatever don't tend to have very much help in ME/CFS pain. So then you go up this ladder and you start with a low dose of amitriptyline or a sedating tricycline, and then you might move up to a low dose of gabapentin, neurontin or pregabalin. And many doctors are not aware of the fact that these are quite useful drugs used properly in some people with pain in relation to ME/CFS, and they're not aware that that is an option that they could use. And this, treatment, which, as we know from our own surveys, some people with ME/CFS do find incredibly helpful, is just denied. It's not there for them. Yeah, as I say, we've got specific leaflets on pain relief and all the different drugs we use with pain relief. I won't go into this in any detail, but you may be aware, and this is something we're obviously discussing at NICE at the moment, as to what guidance to give as to how you diagnose ME/CFS. And there is now quite a lot of support, although I don't like the name, and I think most of my medical colleagues don't like the name of systemic exertion intolerance disorder, or DISE, which was developed by the Institute of Medicine But it is a basis for quite a nice clinical definition of this illness, and that is what ordinary working doctors want in their consulting rooms. And unfortunately, all these sort of big, complicated diagnostic criteria, like the Canadian criteria, are not something that doctors are, generally speaking, willing to use because they take too long in the consulting room. So we do want something relatively simple and straightforward from the point of view of clinical symptoms to make a diagnosis of this illness. Now, I have produced what is, I think, key information on how to make an early and accurate diagnosis for doctors. It's a leaflet that we produce and give out to doctors. I've got quite a few copies here, but you can download it from the MEA website, and it basically summarises how a doctor should make a diagnosis of this illness, what other conditions should be excluded, what blood tests should be taken before a diagnosis is made, and what we call red flags, which should be alerting you to the possibility that you haven't got ME/CFS and you may have something like Lyme disease or all these other conditions, or one of these other conditions where there are overlapping symptoms. As I say, diagnostic criteria and how to make a diagnosis of ME/CFS is a very important thing of what we're doing at the moment with NICE.
Dr. Shepherd?
Yeah.
Sorry, in the slide before, you know where you say there's no support in the UK for SEID. Do you mean the name or do you mean the diagnosis?
Well, I think there's virtually no support for the name. I think it's a pretty awful name, and I have to say it's not caught off with the medical profession over here. It's not being used in clinical or research medicine. It is being used a bit patchily over in the United States, and I'm not sure the patient community has ever expressed any desire for it. But in actual fact, the actual diagnostic criteria which comes with it, I think is actually quite helpful in a clinical setting if you're going to produce something. I think it is useful with some modification. I haven't gone in detail, it's in our purple book if people want to follow it up. But as I say, it hasn't taken off in the way that the Institute of Medicine thought that it might take off as a recognised name and clinical definition. What have I got here? So we've done that. So I was going to do, something else that we're doing at the moment, which is very crucial, and I think it's where an awful lot of problems arise, is just the lack of education to health professionals on this illness. Not only lack of it, but misinformation of health professionals. And this goes right through from medical schools to things like the Royal College of General Practitioners, the Royal College of Physicians, and everything else. So this is work that we're doing mainly with the Forward ME group, which is this group of charities that meets with the Countess of Mar every month or so at the House of Lords. And we have taken to task a whole range of people. We've had Professor Ian Curran from the General Medical Council. We've had representatives of the Royal College of Paediatrics and Child Health, the Royal College of General Practitioners, the Chief Social Worker, etc., to go through with them our feelings about the lack of medical education at both an undergraduate and postgraduate level. There is a wonderful lady. Anyone seen Nina Muirhead? Yeah. No, Nina Muirhead. Nina is a wonderful addition to our armament at the moment. Poor Nina is she's actually a consultant in dermatological oncology. She deals with the surgery of malignant skin lesions at Oxford. And she's very bright, she's very young, and she went down with this illness in a very dramatic and severe form. She'd been in a wheelchair, and she was horrified by, trying to get a diagnosis and all the usual stuff, and in particular the lack of education. Unfortunately, she has an academic appointment at the University of Cardiff. So she and I have been working on various initiatives, particularly her and her medical students, various initiatives to try and get ME/CFS onto the medical school curriculum. She's done a survey of all 45 medical schools in the UK. The results, not surprisingly, were pretty depressing about the fact that many of these students were coming out of medical school, they had no education on ME/CFS, they'd never seen a patient, There was no research going on in the university, there was no clinical service, so it was not surprising. So we are working with the Medical School Council, particularly Nina is, to try and do something about this. And the other thing which I have much more taken on board is to try and do something with general practitioners. We've been up to the last two, I've only just come back from Liverpool, we've been up to their annual conferences. I did a workshop along with Nigel Spate, who's our paediatric advisor, and Gregor Purdy, who's a GP. We did a workshop on diagnosis and management of ME CFS in Glasgow last year to 1,500 GPs, and I was up at Liverpool for their annual conference this year as well. We had a big stand from Forward ME, and we were handing out leaflets and purple books and everything else, and we meet RCGP on a fairly regular basis.
Sorry,
Yeah.
The Forward ME group, is it just a sort of pressure group, or do they have some funding, and whose ear have they got?
Right, so the Forward ME group is a group of basically all the national charities. So we go along, Action for ME go along, ME Research UK go along, not them all, but there's probably about half a dozen of the main national UK charities send a representative there. We meet, as I say, every month or so. We're chaired by the Council of M.E, who's an absolutely wonderful parliamentarian in the House of Lords, who's wonderful at asking questions and trying to set things moving with this illness. And it is basically a question of getting everyone together, one, to try and get some sort of consensus on all kinds of issues, but we act rather like an all-party parliamentary group because we don't have an APPG at the moment. So we get stuck into particular topics, and I say last year was very much medical education, but we also try and invite someone along on some sort of topical issue. It may be a minister, it may be, we had someone from the Health Service Ombudsman this year. So we have people where, if you like, there are problems occurring, and they come along, they get a nice lunch at the House of Lords with Margaret Marr, then they come along to our meeting, give a presentation, ask questions and whatever, and then we try and follow up as we can. So we're not really a pressure group, we're very much a group of people interested in trying to do something at a political or official level.
It works in two directions, so you're giving information upwards and you're getting information downwards.
Yes, yeah.
Do they take donations?
Can I just be assertive? Sorry. Can I just be assertive? I know you don't like me being assertive, but I'm going to be assertive. We're halfway through.
I think unfortunately, I think we're quite well on.
And it's 3 o'clock.
Yes.
I see this as an opportunity to ask some questions, and I really want to see that happen. So can I just ask you maybe just to hold your questions to the end, and let's get through this. I've slightly gone on. We have sort of been diverted with questions. So that's our conference in Liverpool. Quickly on forward. No, we don't have any funds. It doesn't really prevent us too much from what we do at the moment. It's a non-funding thing. Sort of almost finally on management. So I brought along just a few examples of our literature. Please come along and take them, they're all free. And the only thing that's not free, some of you may be aware of this publication, this is free to doctors. We'll send it out to any doctor who wants a copy, but it is, it's 152 pages long, so it costs us about £8 to produce. So if anyone wants a copy of this, then I do have to charge £8. But this is a fully referenced, it's got about 600 references to it. It's a fully referenced summary which is updated every year on everything in the way of papers that have been published in relation to research, diagnosis, blood tests and management. So it's got all the clinical trials, it's got all the key research findings, they're all summarised, they're all referenced, and as I say, it's something that we are quite happy to hand out to doctors. It's primarily produced for doctors, but I've got a few copies of those. If anyone wants one of those, as I say, come and have a look at one if you want to, but I do have to sell those, but the rest of it is free. I brought a few copies of our management report there, which is quite a useful publication. That's a survey, I think it's about 4,000 people we did, and it's just basically, it's information on what helps and what doesn't help with all kinds of symptoms. As I say, those are some of the leaflets I've brought along. I've mentioned DWP benefits. One of the other things that we do at Forward ME is have people from the DWP and the various organisations like Capita and Maximus and ATOS coming along to talk about medical assessments. And I think one of the two key things to take home points about ESA and PAP is this terribly important business about being able to do tasks reliably, repeatedly and safely and in a timely manner. That's something you've really got to get into your application, and there is a very high success rate on appeal if you've got a good case, so do consider appealing if you've got a good case. Turn up in person, that's very important, and provide supported medical evidence if you can get hold of it that hasn't been sent in before. Those are two important things which can help your appeal. I think we're almost at the end. I was going to mention parliamentary matters, and I'm sure many people have heard of our wonderful MP in the House of Commons, Carol Monaghan. She's an SNP member up in Glasgow, but she's really got to grips with this after seeing some people with severe ME up in Scotland and how desperate their situation was. She's organised 2 Westminster Hall debates. We've had an early day motion on it, and we've had a full chamber debate that Carol organised, I think that was back in July. And of course this then leads to meetings with various ministers. We've had a recent meeting with the Minister for Justin Tomlinson at the DWP. Our briefing paper, if you want to contact your local candidates as part of the general election process, we've got a briefing paper, and we've also, it's going up tomorrow, a template letter that you can use to write to all the candidates, raising the sort of key issues of medical education, biomedical research, problems that children have, problems with people with severe ME and CFS have, and anything local you want, which you can send off to your candidates. I am aware, because Sahel sends me the correspondence, that you've got an MP called Albans M.E, who does seem to be quite good at taking up ME CFS issues. Some MPs are absolutely hopeless, useless at it, but some are very good. My own MP, David Drew in Stroud, is absolutely wonderful. And hopefully, if we can re-establish the all-party parliamentary group, which should be APPG, on ME after the election, then we can get a presence in the Commons again to start discussing these issues. Just some details on the ME Association. We've got a website, we've got a telephone information support service, which is, I think, an almost free telephone number, it's open every day of the year. Morning, noon and night. Our full literature list is on the website. We've got a Facebook page, which is very active, where people have raised all kinds of issues, and that's the end. Right. Slightly overrun. Okay, thank you.
Minutes and then
10 minutes, coffee, tea, walk, whatever, and then we'll reconvene for Tuesday.
I'm hot. That's aggressive, isn't it? Yeah. My hands have gone really cold. Yeah. And I'm the I know. That's aggressive, isn't it? It's not. Yeah.